wanted to put voice to the experience that my family and I have had, the ecosystem around my father in the past several months have had in an extended fashion, and I compressed into 1 week when I went down there to take care of him. There are people in this ecosystem today, in the mobile medical ecosystem, who are debating whether community paramedicine, mobile integrated health, and the various other things that this mapping of home health onto emergency medical services is called. This mapping is essential because without someone caring for someone like my father, he's a diabetic, he has had a transplant, and he got an infection. I saw firsthand over a period of roughly 7 days, this cannot be optional in our ecosystem. There are people, if my father was not retired and he did not have my mom taking care of him, if he didn't have the benefit of insurance, if he didn't have children who were able to take care of him and her and give her a break for her own self care, the speed with which he could have found himself out of a job, out of money, out of food, out of a place to live, out of someone or the wherewithal to care for himself and his own medical needs, the speed with which that carnage can occur and set one's life completely off track because of an infection. Not something he asked for, not something he did, but something that occurred. We need that. It's not even a social safety net. It's just a recognition that there are people who don't have anybody else. There are people like Alexandra Drain and her Archangels organization who are trying to cast a light, a bright, overdue, and much deserved light on the caregivers, the silent or unpaid, private, silently suffering caregivers who sacrifice themselves, like my mother. My mother, I have become convinced, is the human embodiment of the giving tree. She will cut off her arms, she will cut off herself in order to care for those she loves. But not everybody has her. Not everybody has a Brenda. Who do they call? Who can they call? The notion that there is a vehicle by which to go to these people cannot be optional. And yet, I was thinking about the best way to convey the drama and emotional complexity of the last, call it 5 months of the year. We've had some extraordinary developments, even over the last couple weeks, in terms of connections made to health information exchanges on behalf of mobile medical services in California, in Colorado, New York State, Michigan. There is so much happening across the state of Texas. And we were thrilled to, at last, receive the patent documents on post-crash intelligence that we've been waiting a number of years to receive. Even as more agencies than ever from the mobile medical ecosystem sign up to participate in the Safe Streets and Roads for All program, leaning into the federal government's efforts to support the work that you do every day in terms of caring for vulnerable road users, caring for yourselves. Make sure that not only are you equipped as mobile medical professionals to respond in an informed fashion to the scene, whether it takes place on a highway or in a school, but that you also have the ability to convey your own health to someone who may come to care for you in the case of a roadway emergency involving your rig. This morning, as I was trying to think about how to balance this emotional roller coaster with these extraordinarily exciting achievements, a colleague of mine conveyed the tragic news that in his neck of the woods, a rural environment, there was a car crash. 3 people were critically injured. 1 died. It's 2025. We're talking about crypto. We're talking about artificial intelligence. And yet, if it wasn't for the phones that have been thrown from the hands of these poor young people who were involved in this crash, their families may never have known where they were. It is overdue. that we close the information gaps, that we no longer debate. We cannot debate whether it is important for information about the people who are involved in a crash, the children who may be in the back seat with an underlying condition like hemophilia, whose parents cannot convey to the responders what their needs are. We can close these gaps. We need to close these gaps. As people live longer, thanks to the miracle of modern medicine, I hope that we can use these occasions, tragic as they are, to begin to ensure that technology is leveraged not just for clicks. My team and I are going to push on these levers. We are going to work with our colleagues, as we already are, at other companies, ESO, ImageTrend, Zoll, Pulsera, members of our community who are working diligently, passionately to connect the dots, close critical gaps, because life can change in a minute.
Beyond Lucid Technology, we move data to help medics and hospitals achieve max efficiency, even during a disaster.